Hey, hello, ladies. How's it going? Hopefully you are having an awesome Wednesday. Um, just making sure we're all good to go. I think everybody can hear me and see me okay. If you can give me a quick thumbs up, I think we are ready to get going. While we're waiting, just briefly, I will say my disclaimer. So, welcome to Wellness Wednesday, you guys, and especially you new ladies. Um, Remember what I share during this Wellness Wednesday tonight is health information and not specific health advice. Um, Also, do not start taking or stop taking or change the way you are taking any of your medications. If you believe that you really should change some of that, please consult first with your prescribing practitioner, and they can help you do that safely. And by attending this Wellness Wednesday tonight, this does not establish a doctor-patient relationship. Okay. All right. Now we've got that out of the way. And it's so exciting to be with you. I know I wasn't able to be with you live last. Well, I was. Uh, we had a bit. It was an off week. Um, so let's get into our content tonight. I'm going to talk specifically tonight about a topic that I think you guys are well aware of. At least many of you are well aware of this. And is in fact, it's one of the reasons why you're even in this group, and it is because of Hashimoto's. Um, when you uh, I talk a lot about Hashimoto's during the master classes that I give, and I'll explain more about that later. But I want to get into some things tonight to just give you an overview and to give you, well, not just an overview. I'm going to dive pretty deep into it, but I want to give you a good idea about what this actually means and why we need to talk about it. Um, and so let's first talk about how it's diagnosed. Hashimoto's is diagnosed by checking blood levels of two different antibodies. And these are the thyroid peroxidase antibodies. These are, uh, one second, I'm getting a quick message. And the second one is thyroglobulin antibodies. All right. So the presence of these antibodies, one or both of these antibodies in the blood, is diagnostic. Now, this is where it gets a little sticky because many of you have gone to your doctors and they've tested you and they've told you that you are negative for Hashimoto's, and yet you have antibodies. All right. The issue is that you cannot almost have Hashimoto's. You cannot have partial Hashimoto's. You can't almost have autoimmune disease. All right. So where there's one or more antibodies in the blood, this is positive for having Hashimoto's, simply because when there are antibodies, your immune system is recognizing um, something wrong in going on in your body. Something wrong, something looks wrong in the thyroid, or maybe with the thyroglobulin proteins in your blood. So something looks wrong, and your immune system then wants to protect you. So, ladies, Hashimoto's is a protective mechanism like any other autoimmune disease is, because your immune system is recognizing something that doesn't look quite right. And it wants to protect you, excuse me, from that thing. And so, unfortunately, as I get into this a little further, you'll understand what's going on and why there is collateral damage, right? All right. So the issue is Hashimoto's is not a thyroid disease. It is not a thyroid problem primarily, or yeah, it damages the thyroid because the immune system damages the thyroid. So it is an immune system disease. It causes damage to the thyroid and mostly results in putting a patient in a hypothyroid state. Okay, not every patient, but most patients with Hashimoto's end up being in a hypothyroid state. Now, if you read the research and talk to doctors who know about this, there's a lot of things you can do to support the immune system with this, those who deal with this condition, these autoimmune conditions. And if you have this condition, all right, then you don't have a primary thyroid problem. And and yet doctors are otherwise just chasing a thyroid problem that isn't there, uh, giving you thyroid replacement hormones where you might need that, of course. I mean, think about it. If you are in a hypothyroid state because of Hashimoto's, then you probably do need thyroid replacement hormone. And so doctor after doctor that you've seen, and many of you I know have seen many, they just attempt to fix your thyroid when you don't even have thyroid disease. It's not a thyroid problem, right? So when you have an immune system disease, right, and the damage that is being done is not just necessarily damage to the thyroid, but the immune system is also likely attacking other parts of your body as well, and you don't even realize it. And you're wondering, well, why do I have this? Why do I have all these symptoms? Are they really hypothyroid symptoms or hyper symptoms for some of you? Are they you're told they're symptoms of hyperthyroid? That's interesting. And many of you may be in a place of where you are just worried about what you are dealing with. You are worried about what happens if it gets worse, right? What would you do if you felt even worse than you do now? Uh, how would that affect your life, or how would it affect the lives of those who live with you, or those you care for, and care about? And so I think if even more important, if there is even something more important than feeling better, it's preventing the disease, or other autoimmune conditions or cancer from happening in the future, because the autoimmune disease, the Hashimoto's, is left to do its damage. Because once you have one autoimmune disease, you are at risk for developing multiple autoimmune diseases as we move through life and age, right? That's the effect of age. It's not that everyone with a certain, who reaches a certain age has some disease, right? So not only do we want to help you to feel better, but we want to prevent all that from happening, right? Now, autoimmune disease, Hashimoto's, we're going to specifically talking about Hashimoto's, is driven by triggers or irritants, right? Triggers cause biochemical and physiologic events that happen in your body every day, sometimes for several times a day, or maybe all day. And when you have those days. Now, these triggers are basically throwing gasoline on the fire. And this obviously is causing the immune system to attack more aggressively the areas of the body that are being affected. Ladies, the key to this condition, by the way, is being able to identify your unique triggers. And then we customize a treatment plan that deals with all of these triggers simultaneously, right? Of course, that's where experience and know-how are very, very, very important. Otherwise, if you're just focusing on the thyroid or giving drugs to palliate the immune system, make it more comfortable, or your symptoms, you're never going to get anywhere, because all these triggers are still fueling the fire. So when these triggers are happening, say they're happening all day, you're going to have days that are bad. You're going to have a lot of days that are bad. You might have some days that are better because they're not triggering the immune attack so much. You're going to have, if these triggers go unchecked, right? This is what leads to nodules and cancer of the thyroid. Hashimoto's is the leading cause of nodules and thyroid cancer. Okay, it can also in this fashion then cause cycles of symptoms. If you can understand what I was just saying about how some days are going to be better than others, maybe weeks, some weeks might be better than other weeks. For some of you, it makes it very difficult to plan because you're constantly having to change your plans. I spoke with a potential patient and her husband the other day, and the husband brought this very point up. Like he said, it's nearly impossible to make plans because they're always changing. They're always being, they always have to um, basically cancel or change their plans, and it's just an an over and over, it's happening over and over and over again, and it's just they don't have any stable plans in their lives anymore, and so they don't hardly do anything anymore. um it's very hard for her to get out of the house and participate, especially in the lives of her grandchildren, and so it makes things very, very difficult for her, and she feels awful for missing things, missing her grandkids events. Now, because of the way these triggers function also, this is why we get sometimes some hyper and some hypo symptoms. So I need to explain a little bit more about the antibodies and the way the antibodies work, especially thyroglobulin. If you have thyroglobulin antibodies in the blood, this causes kind of the opposite to occur. You actually might feel better when these are being attacked, when these thyroglobulin are being attacked, because essentially what's happening is these thyroglobulin protein carriers for the thyroid hormone, they're like transporters. They're like maybe water balloons, with the balloon being the thyroglobulin and the water inside being the hormone. Well, when those are destroyed, of course, it's like popping the balloon, right? And so the thyroid hormone spills out into the system, and then we've got an increased amount of thyroid hormone in your bloodstream and in your system. So for some of you, this can really cause some hyper symptoms. Okay. Others, it doesn't really do that. It just kind of pools in your bloodstream and doesn't really do anything, doesn't really change the way you feel. So many of you are just kind of going along and just cycling a little like this, but some of you are cycling way into hyper symptoms, and some, then after a while, those will give way, and you'll be back to hypothyroid symptoms. All right. So when I say palliate the immune system, I'm talking about, you can take medications like steroids, um, to calm the immune system down, but it doesn't address the triggers. Because once you're off the steroids, then things start happening again. Or they cause major effects, side effects, like increasing your blood sugar and causing weight gain. And I mean, there's just, yeah, and like there's a medicine called hydroxychloroquine, which is used for conditions like lupus and things like that. So sometimes Sjogren's, but so this again, it's just to make the immune system a little more comfortable, if you will. That's what palliate means. Um, and so it just calms it down some. But again, this does not mean that it's going to necessarily calm down the attack on your body. Okay. Um, it's interesting, doctors will continue, then they'll treat other symptoms, right? The pain. I just spoke with a 68-year-old female with arthritis, really bad finger and hand arthritis and enlarged joints. And actually, it makes me think of another one of my patients about the same age who was dealing with the same things. And she's actually done really well, has gone through her customized care plan, and she didn't used to be able to make a fist with her hands, and now she can. Insomnia, they can treat, of course, insomnia. This reminds me of my 70-year-old patient, retired policewoman, who had been taking Ambien, or the generic, I guess, the Zolpidem, for years. just to get to sleep. And she doesn't need that anymore. She's sleeping quite well now. Um, has a couple of natural things she's now taking, but she's sleeping a lot better, and she doesn't have to have that drug, which does permanent damage on the brain. Okay. Um, Doctors can treat low energy. I've had patients come to me on stimulants because they just couldn't stay awake at work. One of them was a pharmacist, of course, working nights at the hospital pharmacy. You got to stay awake. He's got to stay awake, and so. But then he goes to working the day shifts and can't stay awake because he's just out of energy. Um, so he relied on, stimulant medication uh, given by his doctor for that issue, for that exhaustion that he had. He was tired all the time. Pretty much every patient, though, but in particular, I remember speaking with one of my patients. She's a little older, I think in her 70s, whose energy crashed around 3 or 4 p.m. every day. All right. And then, even though she woke up with a decent amount of energy, it just crashed for her, and then she's done for the evening. Uh, Another one, a 47-year-old mom, and working mom, I should say, who's coming home from work, barely getting through her day at work, because of exhaustion, and then gets home from work and goes to bed immediately after eating a quick dinner, if she even eats at all. A lot of you deal with mood issues, deal with depression, anxiety, sometimes being diagnosed with bipolar. I'm sure there's some of you with that label. And I was speaking with a patient. I don't remember her age offhand. I think she's probably in her early 60s, on her eighth or ninth antidepressant that her doctors are trying. And it's just like throwing darts at the dartboard blindfolded, because these drugs have so many different side effects, and that's why she's on her eighth or ninth one, because they just give her such tremendous side effects. Um, and there's skin issues. Of course, you can treat these with creams and you know different whether it's a steroid cream or some other kind of immune modulating cream. There's so many of them. Um, God, is this? I spoke with a lady, one of many of my patients and potential patients with rosacea in her 70s. Another one with lichen sclerosis of the perineum. I mean, this is so uncomfortable. Another gal in her 50s. Okay, I recall with just rapid heart rate, and where this is causing anxiety for her. The heart rate will increase. Um, she'll start having tightness. She gets anxious at that point. Come on, this is an adrenal problem. All right. Not to go too far afield. My point is, you can treat these symptoms all day long. And that's exactly what happens in the traditional medical system. They're treating the ill with a pill, right? And you're never going to get anywhere doing that with autoimmune disease. If the triggers are still throwing gasoline on the fire, and the underlying whatever issue that's causing these symptoms, the underlying disease, again, most often the autoimmune disease affecting, in this case, the thyroid, is just going to get worse and worse, regardless of all these attempts to bandage and cover up the symptoms. I've come across a lot of ladies with POTS or POTS symptoms, maybe not full-blown POTS. Postural orthostatic tachycardia syndrome. And this is becoming much more common unfortunately, after receiving the SARS-CoV shots. You know what I'm talking about. And it's becoming, I just read an article about this, how it's becoming more and more widespread. This was an article even in my medical feed, my medical journal or article feed. It wasn't even in my functional medicine, um, article feeds. And it just, it just, I don't know, I kind of feel like I'm on a soapbox a little bit, but we have to get to these root issues, find your unique triggers if you indeed have this autoimmune disease going on. Otherwise, yeah, you can continue treating the high blood pressure, the diabetes. So, um, again, the very interesting thing about patients with this disease is that it typically results in a very cyclical nature of these symptoms. Okay. Um, and there are a few who, like I said before, um, are thrown more into hyperthyroid type symptoms, but this is very, very rare. So the very interesting thing is doctors see some of these hyper symptoms, uh, and they think it's hyperthyroid because they see a low TSH and they see um, these hyperthyroid-like symptoms like anxiety, heart palpitations. Um, they see a little bit of weight loss. One patient recently was just so irritated because her doctor wanted to again decrease her dose. And every time they do that for her, she just feels so much worse. And yet they're doing it because she's got these palpitations. She's got these, her hair's falling out. They somehow attribute that to hyperthyroid sometimes, but it's hypothyroid. You cannot have symptoms of both at the same time. I'll tell you that. Uh, and she just knew she was gonna be feeling worse if they decreased it again. So I was getting at the interesting thing is you cannot have both types of symptoms at once. Now you can have some days or weeks where you tend more toward one type, like hypo or hyper, but they don't happen simultaneously. So it would, and the symptoms of hyper that we really need to look for would be like super rapid weight loss, tremors, okay, where you didn't used to have anything like that wasn't explained by anything else. A kind of a rush of heat, so hot temperature and heat intolerance. Some people say they feel like they're buzzing. All right. Not always a symptom of this, but it can be. Yeah. Otherwise, if you're not losing weight, if you're tired, if you're not sleeping well, again, not a symptom of hyperthyroidism necessarily. So if you're not sleeping well, if you are have all these other mood issues, cold intolerance, these are hypothyroid symptoms. Okay. All right. So again, the key to fixing this is to find a patient's specific and unique triggers, right? And customizing a care plan that is specifically able to address all of these triggers simultaneously. Okay. This requires getting the right tests to be able to know what specific things need to be addressed. Now, I teach so much more about this in the master classes that I give, and I will be giving a master class in early 2025. So be watching in the group for those dates when I announce them. But this requires so much more information for you to understand what needs to be tested and why, and so I share a lot about that in the master classes. All right, so to recap, Hashimoto's is not a thyroid disease, but an autoimmune disease, immune system problem. Okay. You can't almost have it. You can't almost be pregnant. You can't, be partially pregnant. You either are or you're not. You either have Hashimoto's or you don't. So there's no medicine to treat it. Also, doctors don't look for Hashimoto's because it doesn't change what how they use the one tool and one treatment they have, which is the thyroid replacement hormone. Now, for many, it's just levothyroxine. Maybe for some others, they'll branch out and give you other kinds of thyroid replacement hormone. And just because I said that this isn't a thyroid disease doesn't mean you don't need thyroid replacement. You may, in fact, most often do, depending on how long this has been going on. Okay. Because it most often puts you in a hypothyroid state where you do need additional thyroid hormone to help your whole body function optimally. Okay. But it can cause hyperthyroidism and gets misdiagnosed for Graves as well. So that's interesting too. All right, so the testing is the key. Correct analysis of this testing is also the key, right? To understanding what it is you're dealing with. Then customizing care for our patients is key to helping them reach their health goals and turn things around, put this into remission, because Hashimoto's, when you have this or any other autoimmune disease, it's capable of being put into remission, but you don't get rid of it. Once your body has seen something unusual that it needs to protect you from, it's always going to try. Okay? It's just always going to try. All right. So, I'll leave you with this information tonight. I'll take a couple of questions. And then if there are any, and then we'll wrap up. So let me check. Okay, it does look like we have a couple. The first one is, why does having one autoimmune disease put you at risk for getting more? The reason is, when your immune system is on the lookout for, when it starts to be on the lookout for things that are wrong, or where it's seen something that is wrong, it's even more vigilant about that. It often happens because of toxins. I didn't talk about the specific kinds of triggers. I do that very much in the masterclass. We get really into it and talk about all these triggers. But once your body is aware that something is wrong, looks wrong, it's going to really be on the lookout. And it's the immune system that is kind of on task for that. And when you have triggers, irritants in your body, toxins, it changes the way your immune system functions as well. Some of these toxins and triggers themselves actually make it so that your immune system sees that more. It really puts you on the defensive instead of the offensive. Some of you might have heard about T helper cells or seen it in your research. There are different pathways for these T cells. One pathway is, basically the defensive side of the, if your immune system's the military, it's the defense. The other part that we need to have is the offense. So it gets dysregulated because of certain toxins. And those are the ones we have to find too, so we can help your immune system re-regulate itself. Okay. So that's why that happens. And then, so once you have one, you develop so many others, potentially multiple, and even cancers, because it starts to then affect the genetic material inside your cells. Okay. The next question, is there any food that is a definite no besides the 5 we're already avoiding? In general, I would say no. It just becomes very customized. I'm sorry, it doesn't get easier than it's just, nothing is easy about this. Okay. I mean, it takes someone who knows how to help you through customizing your eating plan when you finally know what's actually going on with the proper testing. Okay. Looks like we have another question. Says, although it's not possible to reverse Hashimoto's, is it possible to put it into remission? And yes, I said it is possible. That's exactly why I'm telling you that getting the right testing is the key. The correct analysis of that testing is key. Customized care to be able to address all of the unique triggers that each patient has is the key to putting this type of disease into remission. Even if we don't specifically identify other specific autoimmune diseases, okay, if I know you have Hashimoto's, I know we have to focus on addressing your triggers. Bottom line. And that's going to help with every other autoimmune disease and help you prevent any other autoimmune disease from occurring. Okay. So looks like that is it. Is that it? Is that all the questions we have? Okay. Well, it's been a pleasure meeting with you again tonight for this Wellness Wednesday. Watch for those dates when they're announced for the next for my next masterclass that I'll give. It's held right here in the group, just like we do these Wellness Wednesdays for any of you new ladies who are here and don't know quite how things work. And if you have any other questions, put them in the comment section. And have a great night, everyone. Thanks for joining me. Remember, there are answers. Please have hope, and you still have the power to heal. All right. Good night, everyone.